So it's not as if we're actually diverting to microbiology on the obstetrics and gynecology and pediatrics channel, but we are actually talking about the Candida albicans because this is a microorganism that is of importance in obstetrics and gynecology because it causes candidiasis. Okay, causes candidiasis. So we are quickly trying to look at the organism, describe it, okay, so that anytime you hear us talking about Candida albicans, let it be that you might have come across it at one time in our lectures. So Candida albicans, of course, you can see the different types of disease conditions that it can cause. Early childhood caries, oral candidiasis, root caries, periodontitis, okay, oral cancers. Then if there's an implant, you can have an inflammation around the implant. Okay, so Candida albicans is a type of yeast infection. So normally the yeast should naturally be living on the body, okay, or in the body, okay, typically without causing harm, okay. But some other conditions such as when the yeast is now growing too much, or maybe your immune system is low, okay, it can now tilt into causing issues to you, okay. So that's why we call it candidiasis. So where is the yeast normally found? On the skin, that's mouth and throat, also vagina, okay, where it can now cause vaginal candidiasis. In the mouth is oral thrush or oral candidiasis, you understand. So it can also be found in intestines, in your nail beds and folds. Occasionally you can see it in bloodstreams and also some internal organs. That's where it can now cause invasive candidiasis, right? So when you culture it, this is how it can be growing. Of course, you can see a growth pattern of a yeast, okay. So what causes it to overgrow? So sometimes you are using antibiotics to treat a different condition. So the antibiotics will end up killing even bacteria that are of very important to you, okay. So this might actually breed up a crisis, okay. Then if your immune system is weak, so that's to tell you that some things that were normally put under check and balance by your immune system are no longer under check and balance again, okay. So diabetes, hormonal changes, poor hygiene and damp environment, use of corticosteroids and immunosuppressants. So just like I was telling you guys, if you do a microscopy of this is what you should see, okay. So types of infection: in the vagina it can cause vaginal candidiasis, in the mouth it can cause oral thrush, in the esophagus can cause esophageal candidiasis, on the skin can cause cutaneous candidiasis. Then when it gets into the bloodstream too much, it causes what? Candidemia. That's the presence of Candida species in the bloodstream, So diagnosis is microscopy, culture, molecular testing. This is microscopy. So treatment is caused by fungal, so you actually use antifungal drugs like clotrimazole, miconazole, fluconazole, intraconazole. Then if it is occurring inside the body, invasive, so to say, you basically have to now use what? Intravenous what? Antifungals, okay. So that's it for this Candida albicans.